floor is yours.
Thanks. Do I have access to move them, or will you just go through the slides for me when I need it?
I can progress them if you need me to.
Yeah, I just wasn't sure how to do that on here.
Yeah, just tell me to move the slide and I will do that.
Okay, we can go ahead to the first one then.
Okay. Oop.
Morning. There we go. Morning, everybody. My name is Lynn Grainger. I currently am with the WVU Department of Behavioral Medicine and Psychiatry at the Mary Bab Randolph Cancer Center. I specialize in grief and bereavement, and I also work with terminal cancer patients currently. So I'm kind of wrapped up in a whole lot of different aspects of grief, hence why I like to present on these things because it's just mostly what my career has been made up of. Prior to this, I was a licensed funeral director in West Virginia. I still hold a state license in that. So all that being said, I'm a very morbid person, so apologies from the start. We're going to be talking about some different things today and pertaining to different forms of grief, different forms of separation and loss. And the whole kind of point I want to try to give you for this very kind of brief synopsis of grief, and believe me, I could talk for hours, but I want to just give you maybe a little bit of a taste of what grief kind of looks like and what most clinicians and professionals might see on a daily basis, just from kind of a beginning standpoint. Also, I'm going to throw in some things about maybe some treatment modalities, just some kind of frontline things that we can all use, whether we're doing in-depth therapy or just more, kind of brief interventions. Apologize. A lot of this I will have to rush some because I could do probably an hour on any of these slides. So I will do my best. And if there's any questions after we're done, by all means, I love sharing knowledge. So if we want to go through the first couple of slides here, that's just a disclosure, don't have any affiliations. Next one should be bio. I already talked about myself, which I hate. Next one, objectives of the day. I kind of already talked about that, but I really just want you guys to have a better understanding of some basic things about grief. We all are going to face grief and loss in our careers and in our personal lives. I always tell my patients or my colleagues that we are all born grieving because we know that eventually we will suffer some form of loss in our life. And we all feel anticipatory grief basically from day one, whether we know what it is or isn't. I do just want to say that I'm going to be talking about some very hard things today and some very sensitive things. And so I do apologize for that, but I try to keep it as upbeat as I can, even though this is a very morbid topic. Um, I do have a morbid sense of humor. I apologize for that too, but that's something that kind of comes with the territory. So we'll go to the next slide, please. So what I want to start off here is I want to talk a little bit about the type of loss that comes along with when a parent and a child are separated. Obviously, I think we are all aware that whenever there is a separation, there is going to be feelings of grief associated with that because no matter what loss we have, separation is going to trigger a mourning or a inward grief response. Most of the time, children and adults don't really grieve that differently. We all have the same kind of mechanisms that occur. Now, the way that we outwardly express them is going to be a little bit different because we're at different points of our life when we're in childhood or when we are in adulthood. Children, whenever they experience a loss post separation, in many cases will experience physical symptoms. There can be symptoms that mimic illness, symptoms that mimic stomach pain, fatigue, and generally there won't be anything that kind of coincides with this. There won't be anything that really syncs up with, well, they're not actually sick. We've taken them to the doctor, they're okay. It doesn't mean that they have something the doctors aren't finding. It is their outward expression of grief that they're not really able to express into maybe words yet, depending on their age. And so their body actually mimics those symptoms for them in the form of physical symptoms. Adults can have this too, but I really see it less commonly. It's more adults can lash out with anger. They can lash out with different emotions that they do have the capability of expressing. And most of the time now, I don't have a lot of experience in dealing with loss when it comes to a separation between a parent and a child because it's just not what I work in. But it is still a loss, so the symptoms will be very similar to what you would say experience after a death or after some other form of traumatic loss. Children are going to grieve the loss of normalcy. They're going to grieve the loss of safety, of security, of that feeling of comfort. Adults or parents are going to grieve a piece of themselves. It's going to be like they lost something of themselves, like the same as if they had an arm amputated, had an organ that was, removed. It literally is something that they feel like they have had taken away from them that is a part of them. And that is a type of pain that you can only really experience when you've felt it. Personally, I've never had that kind of loss, so I can't imagine what it must feel like, but I see it in them. Uh, do apologize. I'm going to be looking down. I've got a legal pad in front of me, and I keep looking down at my notes. So I think that this gives you a general idea, and I know I'm rushing through it just because there's a lot I could say about it, but just remember grief can and will look the same. We just have to look for specific symptomology case by case. Every bit of grief is case by case basis. If we go to the next slide, please. So with children, there's going to be a whole lot of different things that will come up in terms of how they present themselves in grief. We see a lot of anger because anger is one of our oldest and most fixated emotions. So there's already anger present within us. And when we have something taken away from us that we feel so strongly about, i.e., our parent or our security or our safety, that anger is going to come out tenfold. And a lot of times that's not really socially acceptable. People don't understand why either a parent or a child will be experiencing these symptoms because we just don't really teach much about grief. We don't teach much about loss. We know that it happens after someone dies, but we don't think about that happening when two people are separated. And too many times it's stigmatized of, well, the person's still alive, you'll see them again. It doesn't mean it don't hurt. The other thing I like to mention is when there is this type of a loss, especially when it is not pertaining to a death, there's going to be a lot of, kind of things going on behind the scenes for both children and adults. And a lot of times that will manifest into nightmares. So if you are working with children that have recently been separated, there's going to be a lot of sleep disturbance. There's going to be a lot of restless nights. There's going to be a lot of strange dreams that might not make a lot of sense, but it's really mostly centered around just feeling like they might never see their parent again or see whoever it is again. Now, adults will experience the same thing, but they're going to be able to more closely relate those symptoms to what they're going through, and it might not be as hard for them to work through some of that. So let's go ahead and go to the next slide if we can. Okay. I want to touch on the link between grief and substance use disorder. I conducted a brief survey when I was a graduate student, when I worked in an inpatient inpatient unit at Chestnut Ridge. And what I found, out of 50 people surveyed, close to, I believe the number was 42, stated that their addiction either began or worsened following a loss, whether that, and that loss didn't have to be a death. It could have been some type of traumatic loss. When you talk about 42 people out of 50 saying that this is what either started their addiction or worsened it, that is a huge indicator that grief plays a major part in substance use disorder that I think a lot of times gets overlooked. So whenever we are working with adults that have suffered the loss of a separation of them and their child, we really need to be aware that these addictions can be present and can worsen, even though the person might know that in doing so, it could worsen their chances of getting their child back or from, experiencing, better things. It's their body needing something to cope with this immense pain that they've just never had to feel before. So what I always like to encourage is anytime that we're working with substance use disorder, even if there is no apparent loss that we know of, we should always try to couple some type of at least basic grief therapy with substance use disorder therapy. That way we know that we're kind of covering all of our bases, and they might, because they might not even know that what they're actually reacting to is grief because they might not have been taught about it. Obviously, severe depression can couple with this type of loss also, and suicidality and suicidal actions and ideations are always something to look for and kind of, just keep in the back of your mind when you're working with both children and adults post-loss, because it can be a means of regaining control after something so traumatic. Just look at my notes here. Obviously, I see most, just one more point about suicidality, and I'll talk a little more about that later on in the presentation. But when it comes to loss and grief, I see teens have much more of the kind of suicidal thoughts because there is much more of a grasp of wanting to just control anything they can. And so that's a population I would be very much cognizant about when you're working with any type of loss of those kind of safety factors. Let's go ahead to the next slide, please. Okay. So now that I've kind of given a brief overview of all those type of things and stammered through it the best I could, I want to just go into some general information about a whole lot of different things with grief. These are going to be things that, frankly, we all should have been taught in school, but we weren't. And if you guys are all like me, you probably never got more than just basically learning a little bit about Elizabeth Kubler-Ross and the stages of grief, which we now know are true, but they don't really work the way that they were presented to us. Not to mention, what most people don't realize is those stages of grief were done, those studies were done on people that were actively dying, not for those that were left behind post-loss. So we have to make that differential. So I'd like to just give a little bit of an overview of grief and mourning. Grief is the inward expression that we feel. It's the emotions that we experience. It's the things inside of our head that we are feeling when we are grieving the loss of something. Mourning is the outward expression. This is something that used to be way more common in the United States, but isn't anymore because it was deemed as not really socially acceptable. This is the black shroud, the black veils, one of the things that I still see nowadays when there is really one of the only kind of mourning things that I see outwardly is you'll see a black ribbon over a badge if a officer is killed in the line of duty or something like that. And I encourage anyone that is experiencing loss, no matter what type it is, to have that active mourning. Let those emotions out, show those emotions, mourn whatever loss it is. because it is going to be much easier of a journey through grief when you can have that mourning process. Go on to the next slide, please. So normal grief versus complicated grief. Normal grief is what we all experience post-loss. It is the normal feelings of sadness, of yearning, of anger, of just all of the typical things you think of when we experience a loss. With this, generally, you don't need major interventions. Generally, it's more just kind of companionship counseling. You just basically kind of sit there and listen to the person express their emotions and be a companion through it. Complicated grief is when we have something that has drastically altered the grieving process. And a lot of times it depends on the severity and the type of loss. The loss that we're talking about today is separation of parent and child. This is 100% always going to be complicated grief because it is absolutely a type of loss that people don't understand. It is by far not taught anything about. And you'll hear me use this word here in a little bit, and I'll explain it further. It is absolutely disenfranchised grief, which is always an indicator that grief will be complicated, prolonged, and needing more in-depth intervention to help the person work through it. Let's go ahead and move on to the next slide, but let me kind of get caught up in my notes here because I haven't been very good at following my own guides. So, anticipatory grief. Anticipatory grief is the type of grief that occurs post-loss, or I'm sorry, pre-loss. This is the type of grief that Kubler-Ross studied. These are the feelings of grief that we experience prior to, leading up to, or that we watch, or when we watch someone either dying or when we watch something going to occur right in front of us. This is the type of grief that generally is not paid attention to. And a lot of times, it's the type of grief that is the most painful and the hardest to understand because nothing has happened yet. But the feelings and the outward expressions are the exact same as grief post-loss. So we have to kind of start those interventions for grief even prior to anything occurring. That's why I like to make sure that I harp on this a couple different times, because most of our clients or patients are going to experience some type of anticipatory grief on a pretty regular basis because we all experience different losses, whether they be big or small. Let's go ahead on to the next one, please. Delayed grief. Delayed grief is one that it can really sneak up on you. Delayed grief is when you have someone that experiences a loss and they seem like they're doing just fine. They might even go through that normal grieving process that we talked about that doesn't really need any intervention. But then all of a sudden, boom, something happens in their life and all of these feelings just come rushing out. We see this a lot in people that have experienced multiple losses close together. And this can really apply to this situation we're talking about now, because when you talk about first you have the loss of normalcy, then you have the loss of safety, then you just have the loss of not having a person with you. And all of that can stack on top of each other and become compounded grief, which makes it that much harder to unravel, because when you're doing in-depth grief therapy, you have to work through one loss at a time. And when it's delayed, you might have to kind of revisit and come back to treating the same grief over and over and over again because it just keeps reoccurring. Next slide, please. Disenfranchised grief. I probably should have just started with this one. I don't know why I didn't. I guess I didn't structure these slides very well. Disenfranchised grief is the type of grief that nobody thinks we should have. It is the stigmatized type of grief that people feel like they are alone. They have no one that understands what they're feeling, and society says you shouldn't be having. Pet loss, infant loss, loss of addiction, loss of your child, separation with you and your child, any type of loss that people think is stupid. And I hate to put it that way, but I've had so many people tell me, Lynn, why am I grieving this? This is such a dumb thing to grieve. Grieving something is never dumb. Or grieving it, it means it meant something to us, and it means it's something that we loved and cared about. So just remember that whenever we are working with our patients, that when they're grieving, it is because they love something so intensely that they can't bear the thought of being without it. No one should ever feel disenfranchised grief. And as clinicians, it is our job to make sure that we make everyone feel like their grief is valid and worthy of being cared about and treated. Next slide, please. So diagnosing grief. I won't read through all of these. I'll just kind of give you a brief synopsis, and you guys can kind of look at these. These are the questions that I'd like to ask or look at whenever I'm diagnosing someone with persistent complex bereavement disorder, which is the DSM criteria or DSM disorder for grief right now. These questions help me differentiate whether or not I'm looking at actual grief or if I'm looking at major depressive disorder or adjustment disorder or PTSD, because all of these kind of have similar circumstances and have similar symptomology. The big thing I want you to take from this slide is that when you're diagnosing grief in someone, make sure that it is tied to a loss, make sure that it is feelings that would be outside the normal realm of the normal grieving process? Are they more intense than what maybe normal grief would look like? And I know you're probably thinking, what does that look like? I wish I had a better answer, but it's different for every patient. And it goes for adults, adolescents, and kids. It's going to be different in every case. And you have to answer these questions for no matter what age population you're looking at, because grief can really mimic other things. But there are so many people that come in to me saying, I've been treated for depression for however long, and nothing really seems to be helping. And as I delve into things, I find out I really don't think you're depressed. I think you're grieving. And there's never really been any interventions done to help you grieve. So if you find yourself asking these questions, it will help you have a better idea of what you're kind of looking at and dealing with. Just remember that we kind of work within a year process for grief and loss. Any type of feelings of grief or outward mourning over 6 months, we're probably standing a good chance of looking at more of a complicated grief type of diagnosis. Let's go ahead to the next one. So, cultural aspects of grief. The way that we grieve and the way that we look at loss is tied very much to what our cultural circumstances are and where we grew up and how we were taught. Different groups are going to experience different types of grief, and the intensity is going to be a lot more present in certain cultures and subgroups. So whenever we're talking about the loss of a separation, or I'm sorry, separation and loss, we have to remember that depending on the culture we're working with, there's going to be a lot of stigma associated with that. There can be a lot of guilt and shame, especially put onto the parents or even the children based on this loss. their culture could look at them very negatively, which is going to very much impact the way that they're looking at their own grief and how they're processing it. The way this wasn't a funny story at the time, but I'll just tell it real quickly to give you an idea of how grief looks differently in different cultures. When I was still a funeral director, I was conducting an African American Catholic funeral, Catholic Mass. And when I was lowering the casket, the entire room started shrieking. And when I say shrieking, I came about 3 feet off the ground and almost probably jumped on top of the casket. It was that loud and that ornate. And afterwards, I learned that that was the mourning practice of this specific, kind of subset of people. But it was way different than any culture I've ever lived in. And then after that fact, I realized that this is the way that they really outwardly show their grief. And they need to be able to do that in a way that is healthy for them. So embrace it. Learn about a person's culture, learn about how they feel about loss and what those stigmas are. And it will always help you in learning how to treat them. Any treatment modality we do should always be culture based when it comes to grief, because intensity will always worsen grief if not fostered in the right way. Let's see here. Sorry, like I said, I'm looking at my notes. With different cultures, I also like to just throw in that we should probably always look at trying to bring in other either specialists or even I like to throw out clergy of some type or whatever pastoral care maybe a specific culture might prefer, because that will help to kind of mitigate some of those questions we have about the mourning process. And I know that a lot of this sounds like I'm talking about death, but it really does apply to any loss within culture, because specific cultures are going to feel more comfortable sometimes processing these feelings with someone that is directly related to their culture. Let's go ahead and move to the next one. So I kind of already touched on a lot of this with what I just said. I didn't realize I had 2 slides, but I'm just going to double down on with religious practices are always something to take into account with loss and culture. And even when it comes to, working with kids or adolescents, sometimes if that is something that's been ingrained in their culture, that pastoral care can really be helpful in breaking down even guilt or anger at themselves or things that really could enhance even, suicidal or self-harm behavior. Let's go ahead to the next one. Just see how I'm doing on time here. Good. This, I put it in here as the 6 R's because this is when you look up this method, it's what's going to come up. I was taught this method as the teardrop method. Basically, what this is this is the platform when you are working with clients experiencing grief. This is where you should kind of start from and end ideally. This is whether it's normal grief or complicated grief or, kind of brief or in-depth therapy or even just interventions in general. In a nutshell, you have to first recognize and feel the loss. Then you have to accept the loss. Then you have to create a new reality post-loss. Once you create that reality, you have to live in this new reality. And then finally, you have to reinvest in whatever the new world looks like post-loss or post-change. Now, with this type of topic, we're talking about separation, and there is always the hope that things will come back together and resolve. That being said, we're still working from the same modality because even if things do come back to normal-ish at the end, we're still living in a new reality because things have changed and can never go back to the way they were. So just keep this method in mind. And if you're going to take anything from today from me, keep this in mind, because if you work from this type of platform, you can help anyone work through their grief, no matter what kind of setting you're in. Even if it is, if you only see a person in a very, very limited basis, it's still the same theory and you can kind of track progress. I don't like the word progress because everybody progresses different in grief, but you can track how people seem to be doing. Let's go ahead to the next one. So now I'm just going to talk about some kind of basic treatment methods that are helpful. I use these in more of an in-depth long-term therapy setting, but aspects of these, if you want to do some research on or get some specific trainings, these are really good for grief therapy, no matter what type of loss it is. I imagine everyone has probably learned at least a little bit about Gestalt therapy. I know that I had it in most of my classes, and it's been brought up to me in a lot of trainings I've done. Most people know it as the empty chair, and this can help any age range either say or process things with the person that is not there. It gives them the opportunity to say whatever it is that they need to say that they might not have the chance to. Now, I wouldn't just start using this without knowing some type of methodology behind it, because it can get a little complicated. But some basic training on Gestalt therapy can go a long way. And even in brief interventions, aspects of it, it's kind of like CBT. You can take bits and pieces of it and really utilize it into whatever you're working with in terms of loss. Let's go ahead to the next one, please. Okay. This is the one, this is the stuff that I love doing. I love any type of creative grief therapy. When I was going through mortuary school, I had the opportunity to go to a organization called the Good Grief Center in Pittsburgh and learn some from them of how they work with different populations and what they do. And the main thing that they focused on was art and interactive grief therapy. Now, obviously, these can all be used for adults, but man, they're fun to do with kids, even though some of the things you find from them are really, really sad. Shadow boxes are a great thing to do for loss because it helps make a memoriam to what has been lost. Art therapy, and the one that I usually like to bring up, if you see on the left there, there are 3 masks. And what you do is you can buy them from Hobby Lobby, anywhere. You take these 3 masks, they come white, and you have whoever is doing it paint them. The first mask, you have them paint how they felt prior to the loss. The second mask, you have them paint how they felt during the loss. And then the third mask, you have them paint how they felt post-loss. And then you process how they have changed and what the symbolic nature of what they painted is. I have never done this type of therapy with anybody that didn't say it was extremely helpful and eye-opening. And even adults that usually are not open to doing most type of art therapy will do this because it's just kind of really out of the box. The other thing that I really like to recommend is letter writing. Letter writing to whoever or whatever has been lost. Doesn't have to be shared, doesn't have to be discussed, just the fact that they're doing it. And this is a homework that I do give people, and I check in that they're doing it, but I never ask what they're writing unless they want to share it with me. Then I have them take the letters, put them into a box. And then once they have either completed their journey through their treatment or through the grieving process, or they have been reconnected with what has been lost, I have them destroy the letters. Bury them, burn them, shred them, something. A symbolic nature that that completely gets rid of them. So that way, anything that has been written is either just between themselves or whoever was lost or whoever they chose to share it with. And it is a symbolic way of just letting go of that grief at the end of this kind of journey. You can really have fun with that. That's not really in anything that I've ever had training on. It's just something I came up with actually from my funeral days when people would take these letters and put them in the casket with the person that was buried. So, use your knowledge of what you think would best help your clients or your patients. Obviously, play therapy is always good also, especially working with kids. And actually, I highly recommend it with grief because you'll be amazed what kids will project onto whatever they're doing. The one that I think of all the time is a little girl that lost her mother to breast cancer and drew a picture of her mom for me. But then right in the middle of her chest, she drew a giant black circle and just colored it in dark as could be. And I asked what that was, and she said, "That's what killed my mommy." And to her, she didn't really understand what cancer was, but she knew there was something in that area that caused that loss, and that was how she depicted it. And that one's probably one that'll always stick with me, but it was a real eye opener of how kids can interpret things when you let them draw it out or play it out. Let's move on to the next one, please. Okay, solution-focused approaches. Out of everything at all, I probably use this one more than anything. This is one that I know we all were taught about at some point or another. Maybe not in depth, but with grief of any type, we want to keep people moving forward and not getting stagnant. We want to keep them looking for the future, moving forward, looking in that new reality, investing in that new reality. Solution-focused therapy approaches are the best way to do that, in my opinion. Finding ways to get them working towards small and longer-term goals. I don't care what those goals are. Sometimes it's literally just to get out of bed, to take a shower, to feel like a human being. But that is all aspects of solution-focused therapy. And you could even include that into, let's say there is a separation of a parent and child. For parents, a big solution-focused approach is working towards goals that would hopefully get them reconnected. And working that into the therapy modalities is a good way for them to also work through their grief while they are working towards whatever that eventual goal is to get better and to get reconnected. I would highly recommend taking, if you're going to take trainings in something, get certified in solution-focused therapy. It will help you in everything. And frankly, I use it just on a daily basis, which I'm sure my wife hates, and I'm sure my son will hate too when he realizes that's what I'm doing. They do have specific solution-focused approaches for grief, which I'll talk about here in a minute. But if you're really just doing normal kind of grief work and not doing in-depth like true grief work like I do, the basic stuff will get you by just fine. Next slide, please. Oh, okay, there we go. It's the next slide. Okay, integrative cognitive behavioral therapy. This is a treatment method that personally I am not trained in, but it is talked about in every training I do for grief. It's always brought up because I think it is just the absolute best from what most professionals tell me. Because it takes Gestalt therapy, solution-focused therapy, and other approaches and just combines them into one. This is more for intense cases. I mean, I'm talking, we're talking possible like military PTSD, just I can't think of any more off the top of my head, but really traumatic losses. So I just wanted to touch on this. If you guys ever really want to get trained in something that is really in depth for grief therapy, this is what I would look for. So, Next slide. Usually I don't mention too much about this one. I just like to have that training in your mind, and that way it's on something that if you ever want to look it up, you can. Bibliotherapy, great for grief in general, across the board. A couple books here that I really just use kind of off the bat. The first two, It's Okay That You're Not Okay, and The Year of Magical Thinking by Joan Didion. These are just two kind of basic books about grief that you could recommend to your clients or your patients, only for adults. I'll talk about kids' books here in a minute. For you as clinicians and professionals, the other two would be a good place to start. Anything by Alan Wolfheld is going to be a great book. Anything by David Kepler is going to be great for grief training. It's nothing too intensive, but it will give you a really good working knowledge if you're somebody like me that just wants to kind of read more and get a better idea of what these different things look like. These are great resources. Go to the next slide, please. Okay, so these are just a list of kind of basic books that you can start with for kids about grief. The reasons I put these on here are these are ones that don't specifically talk about grief as what happens after a death, because we're not talking about death-related grief right now. These are just books that more talk about grief in general for kids and help them understand what they have experienced and what they're feeling. And frankly, I don't do a lot of bibliotherapy with kids because I don't generally work with kids, but these are the ones that I know have come highly recommended from my research. Just gives you a good place to start if you need something quick to pick up and kind of sit there and go over with kids if you see any. Next one, please. I know I'm kind of rushing through some of these a little bit, but I want to make sure I get through everything while I still have time. Okay, so group therapy. Group therapy for grief is a bit of a mixed bag because all losses are different. And when you're talking about grief groups, you have to remember there's a difference between support groups and therapy groups. Support groups are great for just providing a place for people to have camaraderie. Therapy groups for grief are not necessarily very good because people, even when they've experienced the same type of loss, don't have the same type of loss. I think I said that right. Uh, you can have two people that experience the same type of death or same type of loss, but their feelings will be completely different. So I prefer more one-on-one grief therapy. But for parents that have suffered the loss of a child post-separation, it is great for that because that is a group that has a very common type of struggle. So support groups would be good, therapy groups would be good if you're able to find them. Just make sure that the groups are tailored specifically towards what the type of loss is, or they're going to be kind of ineffective. For kids, I really don't like group therapy for grief. I prefer one-on-one, a lot of play therapy, a lot of just personal interaction so that the kids feel like they are able to absolutely open up about anything about the loss, where in a group setting, can't really do that. I'm not a huge fan of therapy groups for kids in general, but grief specifically, I think one-on-one is a lot better. Same way with teens and adolescents. Let's go on to the next one. So spiritual conflicts and treatments. I kind of touched a little bit on this when I talked about culture, but post-loss, there can be a lot of anger at God. There can be a lot of guilt put onto a person because of their spiritual beliefs. They can look at a situation as I am being punished by God for something I did wrong. And that can really hinder the therapeutic process or hinder the healing process. So I always like to assess when I first meet someone if they have specific religious beliefs and see if they would prefer or would like to have some type of collaboration with pastoral counseling of some type. If so, because We want to address the psyche and the soul. One thing I do here is I work predominantly with our chaplain to address both so that we're facing this anger, this guilt, this depression from both sides, if that's something that is important to the patient. Now, 50% of the country right now is non-liturgical, which means they do not necessarily believe in any form of mainstream religion. It's not counting spirituality, but mainstream religion. So it's not as common as a thing as you would expect, but it's still important to assess for that no matter what. Let's go ahead to the next one. Assessment for suicide, like I said, I've kind of talked about this before also. Safety plan, safety plan, safety plan. Even when it feels like you shouldn't, do it anyways. Because you just never know when those intrusive thoughts are going to pop into somebody's head, because with this type of a loss or any type of a loss, feelings can change in an instant and situations can change in an instant. And it only takes one thing to get thrown on and, compound that grief even more, that just pushes somebody over the edge. With treating suicidal ideations or any type of suicidal thoughts or behaviors with grief, always try to restore hope. Use that solution-focused approach and restore hope in something for the future. Help the person also maintain a bond with whatever has been lost. And that will help them feel like that they don't need to do something drastic in order to make up for the loss. We're all professionals. We all know that it is our job to help keep people safe. And so I don't mean to harp on this so much. I just see so much of it in grief therapy. It's way too common. Let's go ahead to the next one. And so this is my last slide. I just like to always mention that, we all have to look in ourselves when we're dealing with grief and loss, because we've all experienced loss. And we all are going to be triggered by treating loss, because there's no one that's ever void of it. So just make sure that you are processing your own losses, that you have some type of collaboration, you have some type of support that means that you can work through your own grief so that you're better able to help those around you. And you never know what's going to trigger your grief response. So just be cognizant of that, which we're professionals. We already do that, but always helps to keep it in the back of your mind. And I think my next slide is questions, and that's all I have for you guys today. I'm sorry for rushing through everything, but a lot of information.